Paul Ajuk, the Senior Hospital Administrator for Hoima Regional Referral Hospital, said that the Ministry of Health has written to the hospital management, directing them to include the accumulated unpaid water bill in their budget for the 2023-2024 financial year.
We have an arrears of water. I think it's above 150 million. And the National Water has written to us, written to Ministry of Health, and Ministry of Health has written to us that we include it in our budget and we pay off the arrears. But as far as disconnection is concerned, we have not been disconnected.
Ajuk explained that the bill has been accumulating because the hospital has been receiving 35 million shillings every quarter to pay water bills, but the money is inadequate. He appeals to Finance Ministry to increase the allocation to at least 50 million shillings.
An attached letter from the Managing Director of National Water about our indebtedness, and the Ministry of Health advised us to include it in our budget so that we clear out the debt. But and we are going to do that.
Ajuk added that the number of patients that hospital serves has increased significantly, and therefore the water usage has also gone up.
Water is not enough, and it is ring fence. So whatever comes, we send in. So the demand for water, the demand for water is more than what we pay.
Donato Kasigazi, the Deputy Resident City Commissioner for Hoima East Division, called on the Ministries of Health and Finance to work jointly to address the water crisis because it is affecting service delivery at the Regional Referral Hospital.
For us as leaders, we are engaging all the stakeholders to make sure that the water is on so that our people can get services. You can imagine such a regional referral hospital, by not having water just in a single day, what it means. Remember, this regional referral hospital is not only serving Hoima City, it is serving the entire Albertine region, including Democratic Republic of Congo.
In the meantime, Kasigazi pledged that the Resident City Commissioner's office and other district leaders will engage different stakeholders to have the matter resolved.
There is no need for people to start maybe thinking that they will not get services. Actually, we want to call upon our people to come and get services, because as leaders, we have also made what we call the Plan B, but we are engaging these stakeholders to come and manage this issue. And we should really have what we call the long-term strategy, what we call the sustainable approach, so that we don't get into such a time where we find out we're not getting services.
Safian Chiza, a parent with a child with disability, normally collects water from the hospital for domestic use. She says the water crisis has hit all of them, and it is worse for the patients and caretakers. The medical workers are unable to attend to some patients if the procedure needs water.
When we bring our children for rehabilitation, the plaster they use to put on the legs or the arms on our children, they use water. Now we don't have water, so the doctors are there stranded also. The toilets which we are using use water, so we cannot afford now to use the toilets because of lack of water.
Other residents captured the plight of patients and their caretakers, who they said are buying water from vendors expensively, with 120-litre jerrycan sold at 1,000 shillings. Hoima Regional Referral Hospital serves 11 districts, mainly in Bunyoro sub-region, including Hoima, Chikuve, Bulisa, Masindi, Chibale, Kagadi, Chiriandongo, Chankwanzi, Chiboga and Hoima City. Some patients also come from the Democratic Republic of Congo, across Lake Albert in Bulisa district.